CEN Exam Prep Electrical. Question 1. The nurse is triaging a child complaining of fever and rash for 3 days. The nurse notices the appearance of blue-gray spots with a red base on the inside of the child's mouth and a maculopapular rash on the face. Where would be the best location for this patient following triage? Option A. Return to the waiting room in line of sight of the triage nurse. Option B. Resuscitation bay to prepare for intubation. Option C. Isolation room on droplet precautions. Option D. Isolation room on airborne precautions. The correct answer is option D. Isolation room on airborne precautions. The child's symptoms, colic spots, blue-gray spots with a red base on the buccal mucosa, and maculopapular rash, are classic for measles, rubella. Measles is transmitted by airborne particles and requires airborne precautions with N95 mask and negative pressure isolation. Droplet precautions, C, are not sufficient. Question 2. A patient presents with heat stroke. What is the priority nursing intervention? Option A. Administer antipyretics. Option B. Rapid cooling with cold water immersion. Option C. Administer 4 fluids. Option D. Obtain a core temperature. The correct answer is option B. Rapid cooling with cold water immersion. Heat stroke is a life-threatening emergency requiring rapid cooling. Cold water immersion is the most effective method. Antipyretics, A, are not effective for heat stroke, as the elevated temperature is from environmental exposure, not a reset hypothalamic set point. 4 fluids, C, are important but cooling is the priority. Obtaining core temperature, D, is important but should not delay cooling. Question 3. A patient with a wrist sprain is being discharged. Which instruction is most appropriate? Option A. Apply heat for the first 24 hours. Option B. Apply ice for the first 24-48 hours. Option C. Begin range of motion exercises immediately. Option D. Avoid immobilization to prevent stiffness. The correct answer is option B. Apply ice for the first 24-48 hours. For acute sprains, rest, ice, compression, elevation is recommended. Ice should be applied for the first 24-48 hours to reduce swelling. Heat, A, is applied after 48 hours for muscle relaxation. Immediate range of motion, C, can worsen injury. Immobilization, D, is needed initially for healing.
Stressed about your Colorado real estate? We can take Colorado real estate for you remotely and undetected. We always guarantee A-Pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done.
Question 4. A patient is diagnosed with bacterial meningitis. The nurse anticipates the following finding on physical examination. Option A. Positive Kernig's sign. Option B. Positive Hohmann's sign. Option C. Positive Brudzinski's sign. Option D. Both A and C. The correct answer is option D. Both A and C. Kernig's sign, resistance to passive leg extension with the hip flexed, and Brudzinski's sign, involuntary hip flexion with passive neck flexion, are classic signs of meningeal irritation in bacterial meningitis. Both may be present. Hohmann's sign, B, is associated with deep vein thrombosis. Question 5. Which nursing intervention is most important for a patient with an ING tube to low intermittent suction? Option A. Change the ING tube every 24 hours. Option B. Provide frequent mouth care. Option C. Maintain the patient in a supine position. Option D. Flush the tube every 8 hours with 50 ml of sterile water. The correct answer is option B. Provide frequent mouth care. ING tube to suction can cause a dry mouth and sore throat. Frequent mouth care, including oral hygiene and moisturizing lips, is essential. The tube does not need to be changed daily. A. Supine position, C, increases risk of aspiration. Flushing, D, depends on hospital policy and should not use large volumes. Question 6. A patient presents with acute pelvic pain, fever, and cervical motion tenderness, chandelier sign. What is the most likely diagnosis? Option A. Ectopic pregnancy. Option B. Ovarian torsion. Option C. Pelvic inflammatory disease. Option D. Appendicitis. The correct answer is option C, pelvic inflammatory disease. The classic triad of PID is pelvic pain, fever, and cervical motion tenderness, chandelier sign on bimanual exam. Ectopic pregnancy, A, would present with pain and bleeding but often no fever. Ovarian torsion, B, presents with sudden, severe unilateral pain without cervical tenderness. Appendicitis, D, presents with right lower quadrant pain. Question 7. A patient presents with an acute shoulder dislocation. The nurse notes the arm is held in abduction and external rotation. What is the most likely type of dislocation? Option A, anterior dislocation. Option B, posterior dislocation. Option C, inferior dislocation. Option D, superior dislocation. The correct answer is option A, anterior dislocation. Anterior shoulder dislocation is the most common type and typically presents with the arm held in slight abduction and external rotation. Posterior dislocations, B, are less common and present with the arm held in adduction and internal rotation. Inferior, C, and superior, D, dislocations are rare. Question 8. A patient with COPD is receiving supplemental oxygen. The nurse is most concerned if the patient's oxygen saturation is maintained at which level? Option A, 88-92%. Option B, 93-95%. Option C, 96-100%. Option D, 85-88%. The correct answer is option C, 96-100%. In COPD patients, the goal is to maintain oxygen saturation between 88-92%. Excessive oxygen can suppress the hypoxic drive and lead to hypercapnic respiratory failure. A saturation of 96-100% is too high and may worsen ventilation in these patients. Saturation below 88%, D, is too low.
Are you looking for Colorado real estate actual questions? Visit our website pokerexams.com to access Colorado Real Estate Study Guide with actual questions and answers. Scan the QR code or click the link in the description to get Colorado Real Estate Answer Key today.
Question 9. A patient is brought to the ED after a violent assault. What is the first priority in caring for this patient? Option A, obtain a forensic evidence collection kit. Option B, perform a thorough physical exam. Option C, ensure patient safety and medical stabilization. Option D, contact law enforcement. The correct answer is option C, ensure patient safety and medical stabilization. The ABCs in medical stabilization are the priority for any patient, including victims of violence. Forensic evidence collection, A, physical exam, B, and contacting law enforcement, D, are important but secondary to medical stabilization. Question 10. A patient in her second trimester of pregnancy presents with painless vaginal bleeding. What is the priority assessment? Option A, fetal heart tones. Option B, maternal vital signs. Option C, cervical dilation. Option D, contraction pattern. The correct answer is option B, maternal vital signs. Painless vaginal bleeding in the second or third trimester is concerning for placenta previa. Maternal hemodynamic status is the priority. Assessment of fetal heart tones, A, and contraction pattern, D, are important but secondary. Cervical examination, C, is contraindicated until placenta previa is ruled out due to risk of catastrophic hemorrhage. Question 11. A 25-year-old female presents with acute onset of severe lower abdominal pain and vaginal bleeding. The patient states she is 8 weeks pregnant. What is the priority nursing action? Option A, administer 4 fluids. Option B, obtain a urine pregnancy test. Option C, prepare for immediate surgery. Option D, assess for signs of hypovolemic shock. The correct answer is option D, assess for signs of hypovolemic shock. The patient's presentation of pain and bleeding in early pregnancy is concerning for ectopic pregnancy or spontaneous abortion. Hypovolemic shock can develop rapidly with intra-minus abdominal bleeding. Assessment of vital signs and signs of shock are the priority. 4 fluids, A, may be needed, but assessment comes first. A urine pregnancy test, B, is unnecessary, as the patient already knows she is pregnant. Surgery, C, may be needed but is not the first step. Question 12. A patient presents with acute kidney injury. Which laboratory finding is most consistent with prerenal azotemia? Option A, Bun/CR ratio 20:1. Option B, Bun/CR ratio 10:1. Option C, normal Bun/CR ratio. Option D, elevated CR with normal Bun. The correct answer is option A, Bun/CR ratio 20:1. In prerenal azotemia, decreased renal perfusion, the Bun/CR ratio is typically 20:1 due to increased reabsorption of urea. In intrinsic renal disease, the ratio is typically 10:1. B. Normal ratio, C, and elevated CR only, D, are not characteristic of prerenal azotemia. Question 13. A patient presents with organophosphate poisoning. Which symptoms would the nurse expect? Option A, pinpoint pupils, bradycardia, excessive salivation. Option B, dilated pupils, tachycardia, dry skin. Option C, constricted pupils, tachycardia, dry mouth. Option D, pinpoint pupils, hypertension, excessive salivation. The correct answer is option A, pinpoint pupils, bradycardia, excessive salivation. Organophosphate poisoning causes cholinergic crisis with muscarinic effects, miosis, pinpoint pupils, bradycardia, salivation, lacrimation, urination, defecation, and bronchospasm. Dilated pupils, B, is seen with anticholinergic poisoning. Dry mouth, C, is seen with anticholinergic poisoning. Hypertension, D, is less characteristic. Question 14. A patient at 34 weeks gestation presents with vaginal bleeding and abdominal pain. What is the priority nursing action? Option A, assess fetal heart rate. Option B, obtain maternal vital signs. Option C, prepare for emergency delivery. Option D, perform a pelvic examination. The correct answer is option B, obtain maternal vital signs. The ABCs and maternal stabilization are the priority. Vaginal bleeding in the third trimester may be from placental abruption or placenta previa. Maternal vital signs indicate hemodynamic stability. Fetal heart rate, A, is important but secondary to maternal status. Pelvic exam, D, is contraindicated until placenta previa is ruled out. Question 15. A patient with an open fracture of the tibia is brought to the ED. What is the priority nursing intervention? Option A, administer 4 antibiotics. Option B, cover the wound with a sterile dressing. Option C, check distal pulses and sensation. Option D, apply a splint. The correct answer is option C, check distal pulses and sensation. In any fracture, especially open fractures, neurovascular assessment distal to the injury is the priority. Checking pulses and sensation ensures there is no vascular compromise or nerve injury. 4 antibiotics, A, wound dressing, B, and splinting, D, are important but secondary to neurovascular assessment. Question 16. A patient is brought in with a nail gun injury to the chest. What is the priority nursing action? Option A, remove the nail. Option B, apply pressure to the wound. Option C, obtain a chest X-ray. Option D, assess for pneumothorax. The correct answer is option D, assess for pneumothorax. A nail gun injury to the chest can cause pneumothorax, hemothorax, or cardiac injury. The priority is to assess the airway and breathing. The nail should not be removed, A, as it may be tamponading a bleeding vessel. Pressure, B, may be applied but the priority is assessment. Chest X-ray, C, will help determine injury but follows assessment. Question 17. A patient presents with a complaint of severe headache and photophobia. The patient has a temperature of 101 degrees Fahrenheit and nuchal rigidity. Which triage category is most appropriate? Option A, ESI 1. Option B, ESI 2. Option C, ESI 3. Option D, ESI 4. The correct answer is option B, ESI 2. A patient with fever, nuchal rigidity, and photophobia is at high risk for meningitis and requires rapid assessment, ESI 2. The patient is not unstable enough for ESI 1A, but needs to be seen quickly. Question 18. Which fracture requires immediate surgical intervention? Option A, clavicle fracture. Option B, open fracture of the tibia. Option C, radial head fracture. Option D, ankle fracture. The correct answer is option B, open fracture of the tibia. Open fractures are surgical emergencies that require immediate antibiotics, tetanus prophylaxis, and surgical debridement to prevent osteomyelitis. Clavicle fractures, A, radial head fractures, C, and ankle fractures, D, are typically managed non-surgically or with delayed surgery.
Stressed about your Colorado real estate? We can take Colorado real estate for you remotely and undetected. We always guarantee a pass and payments only after results. To send us an email, scan the code or tap the link in the description and let's get it done.
Question 19. Which symptom is most characteristic of a subarachnoid hemorrhage? Option A, sudden, severe thunderclap headache. Option B, gradual onset of confusion. Option C, focal weakness on one side. Option D, loss of consciousness without headache. The correct answer is option A, sudden, severe thunderclap headache. Subarachnoid hemorrhage classically presents with a sudden, explosive thunderclap headache described as the worst headache of the patient's life. Focal weakness, C, is more common in ischemic stroke. Gradual confusion, B, is less characteristic. Loss of consciousness without headache, D, is not typical. Question 20. A patient is experiencing acute panic attack. Which of the following is the most appropriate nursing intervention? Option A, administer lorazepam immediately. Option B, provide reassurance and remain calm. Option C, place the patient in seclusion. Option D, encourage deep breathing and mindfulness. The correct answer is option B, provide reassurance and remain calm. A calm, reassuring presence is the first line intervention for a panic attack. Remaining with the patient and speaking in a calm, quiet voice can help to escalate the situation. While lorazepam, A, may be used for severe cases, it is not first line. Seclusion, C, may increase anxiety. Deep breathing, D, is helpful but the nurse's calm presence is the initial priority. Question 21. A patient with a known history of aortic stenosis presents with syncope. Which medication should the nurse avoid administering? Option A, 4-normal saline. Option B, 4-nitroglycerin. Option C, 4-morphine. Option D, 4-oxygen. The correct answer is option B, 4-nitroglycerin. Patients with aortic stenosis depend on preload to maintain cardiac output through the narrowed valve. Nitroglycerin reduces preload and can cause severe hypotension and cardiovascular collapse in these patients. 4 fluids, A, are appropriate to maintain preload. Morphine, C, should be used cautiously. Oxygen, D, is safe but not the primary concern. Question 22. A patient with a diagnosis of bipolar disorder is brought in for mania. Which of the following is a priority nursing intervention? Option A, administer lithium immediately. Option B, ensure the patient is in a safe, calm environment. Option C, restrict fluid intake to prevent water intoxication. Option D, place the patient in seclusion. The correct answer is option B, ensure the patient is in a safe, calm environment. Safety is the priority. A calm, safe environment with decreased stimulation can help manage manic behavior. Lithium, A, may be prescribed but administration is a provider order. Fluid intake, C, should be monitored but lithium requires adequate fluid intake. Seclusion, D, is only for imminent danger. Question 23. A patient is brought in with a diagnosis of schizophrenia who is actively hallucinating. What is the best nursing approach? Option A, tell the patient the voices are not real. Option B, ask the patient what the voices are saying. Option C, ignore the patient's hallucinations. Option D, place the patient in restraints. The correct answer is option B, ask the patient what the voices are saying. It is appropriate to ask the patient about the content of hallucinations in a non-judgmental manner. This helps assess for command hallucinations that may be dangerous. Telling the patient the voices are not real, A, denies their experience. Ignoring, C, is dismissive. Restraints, D, are unnecessary unless the patient is a danger. Question 24. Which of the following is the earliest sign of cardiac tamponade? Option A, muffled heart sounds. Option B, JVD. Option C, pulsus paradocus. Option D, hypotension. The correct answer is option A, muffled heart sounds. The classic Beck's triad includes muffled heart sounds, JVD, and hypotension. Muffled heart sounds are often the earliest sign because fluid accumulating in the pericardial space dampens the audible heart sounds. JVD, B, occurs as right heart filling is impaired. Pulsus paradocus, C, is a later finding. Hypotension, D, is a late sign indicating severe hemodynamic compromise. Question 25. A patient is brought in with suspected carbon monoxide poisoning. What is the most important diagnostic finding? Option A, carboxyhemoglobin level. Option B, ABG with PAO2. Option C, methemoglobin level. Option D, white blood cell count. The correct answer is option A, carboxyhemoglobin level. Carboxyhemoglobin, COHB, level is diagnostic for carbon monoxide poisoning. ABG PAO2, B, may be normal despite severe hypoxia because co-binds to hemoglobin. Methemoglobin, C, is seen with other toxic exposures. WBC, D, is nonspecific.